To this week's edition of San Joaquin Delta Health Beat. I'm Chuck Charlson.
And I'm Laura Winters, and today our topic is type 2 diabetes.
Tonight we address a pandemic spreading quietly throughout our nation. It affects the young and the old and carries serious consequences, such as risk for heart disease, kidney disease, loss of sensation, and can take an estimated 10 years off your life expectancy. This silent killer shows no preference as it affects individuals of all races, genders, creed, and age. It is suspected approximately 9% of the population is living with this disease already. That's 29.1 million Americans, and the number is on the rise. And the age of those affected is getting lower and lower every year. The insane part of all this, diabetes type 2 is completely preventable if the right lifestyle choices are made. Tonight we address diabetes mellitus, specifically type 2. And we show how a nation can prevent and fight back.
Type 2 diabetes is a chronic condition that affects the way your body uses sugar for energy. Normally, your body breaks down food into glucose and sends it into your bloodstream. Insulin, a hormone made by your pancreas, helps glucose go from blood into the cells so that it can be then used for energy. If you have type 2 diabetes, your body does not use insulin properly. This is called insulin resistance. At first, your pancreas makes extra insulin to make up for it. But over time, it isn't able to keep up, and it can't make enough insulin to keep your blood glucose at normal levels.
Type 2 diabetes is commonly overlooked in today's society, but healthcare providers warn that it is becoming a pandemic, and the majority of us are at risk. Tonight, we address how to prevent acquiring the disease, the lifestyles that put you at higher risk for developing it, managing the disease, and the dire consequences of not taking diabetes seriously. Scary stuff, Lauren.
Family history is actually one of the risk factors for developing type 2 diabetes, and it's one that you can't change, along with age, race, gender. But there are things that you can change, other risk factors, such as being overweight, smoking, high blood pressure, unhealthy cholesterol levels, poor eating habits, poor exercise habits, and even high blood sugars that are completely within your control. In fact, according to the American Diabetes Association, studies have shown that type 2 diabetes can be prevented or delayed by losing just 7% of your body weight. So for a 200-pound individual, that would be equivalent to about 15 pounds. And though regular physical activity is also one of the things that you can change. In fact, they recommend 30 minutes a day, at least 5 times a week.
Great point, Jan. It is important to know signs and symptoms of type 2 diabetes, especially if you are at high risk for the disease. Signs and symptoms include increased thirst, frequent urination, weight loss, fatigue, blurred vision, slow healing sores or frequent infections, areas of darkened skin. If you feel you have signs of the symptoms of diabetes type 2, it is important to let your doctor know.
That is great information, Alex.
This just in, our correspondent is at a local clinic where diabetes education is taking place as we speak. Hello.
Hi guys, I'm here with Nurse Gabby and Kristen. We're at our diabetes clinic, and Kristen is newly diagnosed with type 2 diabetes. So Gabby is explaining to her how to check her blood sugar at home. Gabby?
Sure, thank you. Okay, so we have a home kit, which is basically comes with your glucometer, it comes with some test strips, and also your lancet. And then you want to have alcohol wipes. It's really good to have it on hand. It just prevents infection. So then you just go ahead and open that, and then you can just prep whatever area you want to use. Okay. It's very good to rotate sides, and you want to pick a side that has a little bit more tissue. It'll be less painful, but it's whatever your preference says.
Okay.
Okay?
So just wipe it off.
Exactly. And then you'll take this part, and you'll hold this with your right hand. And then there's going to be a button that you can push here. And you want to hold it against here, and as soon as you're ready, go ahead and push that button, and there you go. Okay. And then you can go ahead, if not enough blood comes out, you can squeeze out the blood. And then you're going to want to pick up your glucometer, and just put it to the side where it can scoop it up. There you go.
Now it's counting down.
And if we had some tissue, you could definitely
you could also just
Use that again, perfect. And so you can go ahead and read it.
okay. 125.
Okay, great.
So her blood level is, or sugar level is 125. So what does that mean?
Well, in this reading, her blood level is within range. But some people take it at different times during the day, so sometimes people will do a fasting blood glucose level. And that's usually before meals, it's usually an hour before meals. But in this case, we did it randomly in the day, so it should just be under 125. So she is within desired range. So that's 125 milligrams per deciliter. If we're doing the fasting blood glucose, which is the hour before a meal, it should be between 70 to 100. That's your desired range.
Okay. So her blood sugar is good today. What is she going to have to do in the future to keep it under control?
Well, another part of that is we can actually monitor how well she's been managing her blood glucose using hemoglobin A1C test. And what the hemoglobin A1C test is, it's usually done every 2 to 3 months, but it's sort of like a chemical, like a milestone. So basically, when she comes in, we can do her labs, and then it basically just shows us how well she's been monitoring her blood sugar levels. So we can actually see the level of sugar in her blood over the past 2 to 3 months.
So it's kind of like an average.
Exactly. And so we would want to keep it in between 4 to 7. That is our desired range. So we're going to know if you haven't been adhering to your medications and proper diet.
Okay. And is she going to have to take insulin?
At this point, no. But as the disease progresses, it could be necessary. It's up to the prescriber. But usually physicians will prescribe something like...
Metformin is what my doctor gave me.
That's very true. Metformin. So, for example, metformin, that actually increases your body's tissue sensitivity to insulin. So, whatever insulin her body is producing now, early at a stage, it uses it more effectively.
And why is it so important for her to keep her diabetes under control?
Well, because diabetes can have such further complications. It can nearly affect every organ in the body, and so that can be heart, blood disease, kidney disease. She can suffer from blindness, diabetic neuropathy. A lot of it is losing blood to the nerves. So if there's that, then she can feel painful sensations in her upper and lower extremities. Also gum disease, tooth loss. It's really important to manage it all such early in her diabetes.
Wow. Well, thank you, Nurse Gabby, for that important information. Kristen, good luck in the future. And this is Live with the Diabetes Clinic. Back to you guys.
Cool. Thank you, guys.
Thank you, Monica. Wow, so many great reasons to keep your blood sugar under control. And by the way, I love those white scrubs. I bet they will be making a comeback in the medical community everywhere. Don't you think, Juan?
I don't know about that, Emily. But you know, even people who normally manage their blood sugars very well can be thrown for a loop when they experience illness, a medication change, or surgery.
It's so true. During times of illness, such as having an infection, blood sugar levels can rise, causing hyperglycemia. If you're diabetic, it's important for you to talk to your doctor and know what procedures you should take during these times of being sick. That way you know exactly how to keep your diabetes under control.
People with diabetes also need to be aware of the side effects of any new medications they are taking. Medications containing glucocorticoids can cause a rise in blood sugar levels, and medications such as beta blockers can mask symptoms of low blood sugar or hypoglycemia. When taking these types of medications, it is important to closely monitor your blood glucose.
You mentioned hypoglycemia or low blood sugar. Managing diabetes means knowing how to watch out for and treat low blood sugar, which can escalate to a medical emergency. We have here on the screen common causes and warning signs. If you experience any of these symptoms, you should check your blood sugar right away and treat for low blood sugar if it's below 70. Treating can mean eating 3 packets of regular sugar or drinking 4 ounces of regular fruit juice or 6 ounces of regular soda. Just be sure it's not diet. Recheck your blood sugar again in 15 minutes, and if it's still below 70, repeat that treatment. Now, if you're not able to check your blood sugar, it's recommended that you treat anyway to be safe. Learning to control your blood sugar and avoid these pitfalls may seem daunting, but don't worry, you're not alone. Most local hospitals and clinics offer diabetes education. Here in Stockton, we have diabetes education programs at both St. Joseph's and Dameron hospitals. We have it listed here for you. And if you prefer to search the internet from home, we also have the websites for American Diabetes Association and also Unite for Diabetes San Joaquin County. We will have links to all of these resources on our website. We want to thank you again for watching the San Joaquin County Health Beat. This is Laura Winters and
Chuck Charleston.
we want to say stay healthy.
Diabetes prevention, diabetes prevention, diabetes prevention.